Lymphoedema. You probably don't even know what that is. We're going to talk about it today, what it is, why it happens, how to treat it. Welcome to Talking with Docs. I'm Dr. Brad Winnie.
And I'm Dr. Paul Zalzal. We have a guest today. I'm so excited. This is our first American guest on our channel, Dr. Chuback, who is quite a renowned cardiothoracic surgeon and has a lot of side gigs too. You have your own YouTube channel yourself, don't you?
I'm just a neophyte in the subject, but I'm looking forward to doing what you guys have done. Yes, thank you.
I love it. Well, thank you so much, Dr. Chuback, for coming and hanging out with us and talking with us docs about lymphoedema.
And that's what we do. We bridge Canada-U.S. relations. Diplomacy.
Right. You know what? It does. Medicine doesn't really know geography, right?
No,
same
agreed.
Physiology, same pathophysiology, whether you're Canada or the U.S. or any part of the world. I guess the big difference is in the U.S., you treat more sunburns, we treat more frostbite, I would say. Aside from that, it's pretty much the same thing. And we'll put Dr. Chuback's links in the description in case you want to check out his podcast, his YouTube channel, or what he's getting up to.
Let's start at the beginning. What actually is lymphoedema?
Well, lymphedema is a really, really important disease entity to know about. It is very, very poorly understood generally by doctors and healthcare providers. And one of the things that we've been doing at the Lymphcast podcast the last couple of years is trying to raise awareness, not only for the public who may be suffering with these problems, but also for physicians and healthcare providers. Lymphedema is basically a situation where, for a various number of reasons, the lymphatic system is not functioning properly or up to its full potential, and you wind up getting swelling. And the swelling can be in different parts of the body. Generally, we think about the legs, but it can be an upper extremity, it can be in the face, the neck, it can be literally anywhere. In the private areas, it can be in any part of the body. And for people who develop lymphedema, it can be a really, really distressing and really disabling problem.
Okay, now our viewers are really smart. So can you explain to them kind of what lymph is and what our lymphatic system is and like what does it do? Why do we have one?
Yeah, it's a great question. As the doctors probably would attest, unfortunately, even now, we're all a little bit older now, but even now I know for a fact, in speaking to my colleagues who are still at major teaching institutions, the lymphatic system gets almost no recognition whatsoever.
I was going to say, if I'm the lymphatic system, I'm upset because we all talk about the arterial system all the time, right?
Sure.
Your arteries, we all talk about the venous system all the time.
Yeah.
But equally important is the lymphatic system, and it is essentially ignored.
Yeah, it's the Rodney Dangerfield of the circulation.
No respect.
It's no respect whatsoever. That's for sure. Yeah, and you know what you mentioned is absolutely true, Dr. Zalzal. The lymphatic system is part of the circulation, part of the circulatory system. But what makes it so fascinating and so important is that it's also a part of the immune system. Right. It's one of the few systems in the body is literally a part of two different systems. And so that is an important part of the discussion as well. First thing I would say about the lymphatic system, the way I like to think about it, and I think this helps a lot of not just viewers, lay people, and patients understand, but even my physician colleagues. I always like to think of, if you can visualize sort of a driveway, a blacktop driveway, and if you were to put a hose on that driveway and you open up the spigot on the house, that hose is small in caliber and high in pressure. That's your arterial system, just plowing water out onto that driveway. Then you think about a shop vac. Shop vac has a large opening, kind of a lower suction value or force, but it's much larger. That's your venous system. Right. And what a lot of people don't know, and even some physicians forget this from our physiology and microanatomy and histology and so forth, those two entities are not sealed tightly. There's actually a tiny gap between the arterial inflow and the venous outflow, and that allows oxygen exchange and nutrient exchange and gas exchange and all these things that need to occur. So you can imagine there's going to be some leakage, there's going to be some seepage there. So I like to imagine that hose lying on the blacktop and that shop vac right next to it, but not sealed with duct tape or anything like that. And that shop vac's going to do a good job, slurping up that that blood after the oxygen exchange occurs, but there's going to be water spilling out onto the blacktop. Now you think about the sump pump. There's a sump pump now sitting next to that system in each and every tiny little millions and millions of these little micro connections. And that sump pump is your lymphatic system. And that's slurping up, sound effect, slurping up whatever fluid is escaping out onto the blacktop to keep that blacktop nice and dry. So that lymphatic system is essential to pull up that extra fluid that wants to collect in the soft tissues, the fatty tissues, etc. And then the last piece of it is that that sump system is then made up of a series of channels or vessels, very, very fine. We're surgeons. We've operated on thousands and thousands of patients. You almost never see a lymphatic vessel when you're operating. In the textbooks, they show them as green, but in real life, I can assure you they're not. It would be helpful if they were, but they're clear and they're invisible and they're tiny. So there's a very fine network, but those channels, those lymphatic vessels, then lead to lymph nodes. And those lymph nodes are the immune component of the lymphatic system, which are really, really important. They have specialized cells inside of them that are always surveilling, looking for any kind of foreign invader, bacteria, fungi, viruses, parasites, malignant cells. And they have a special set of functionalities that allow them to identify anything that's foreign to the body and trap it and grab it and gobble up that element and try to destroy it. So there's an important immune function to the lymphatic system too that people forget about.
Wow, if I'm the lymphatic system now, I'm thankful that someone finally explained it so perfectly with an analogy.
It deserves respect.
It does, and that was a great explanation. Thank you for that.
And what's neat about it is it functions at a significantly lower pressure than the venous system. It has a lot more permeability, so the endothelial cells are not quite as close together, so stuff can kind of flow in and out. And it is a one-way valve system like a vein. And it's mostly moved by our muscles, right? They're like passive movement back to the upper part of our body where it then enters into our subclavian veins and then back into regular circulation where our bodies take out the proteins, take out the important stuff, and get rid of the dirty stuff. Is that correct?
Exactly right. Exactly right. And that's why, let's say, for example, a classic example is, let's say, a breast cancer. You know, God forbid a woman should develop a breast cancer. Typically, the doctor, the surgeon, will do some sampling of the lymph node under the arm to see if any cancerous cells have escaped the localized area and have been pulled up by the lymphatic system and trapped in the what we call axillary lymph node in the underarm area. And that's important for staging. But it shows us how important the lymphatic system is in terms of its immune function, in recognizing those cancer cells and stopping them in their tracks as soon as they can before it gets out further into the circulation. But B, it brings us to an important subject of where one clinical scenario where a woman and a man, because let's not forget about male breast cancer, which can be very deadly because it's often missed, women and men could have a biopsy of those lymph nodes under the arm, and that injury to that lymphatic system could potentially lead to swelling in the upper extremity, and that's what we call lymphedema of the upper extremity, which is very important.
Okay, so that we've covered what the lymph system is, and that's a great segue to what can go wrong with the lymph system. Lymphoedema. Can we just quickly discuss some of the causes, risk factors, who gets it? You mentioned that one case, which is very important. Let's talk about some other causes, cases, risk factors.
Yeah. Well, as physicians, as you know, we like to break things into sort of general categories because it makes it easier for us to organize it in our minds and draw upon it when we need to. So the two big categories are primary and secondary lymphedema. Primary lymphedema would be a situation where either congenitally, just through an abnormal development in utero, in the fetus, for whatever reason, the lymphatic system may be underdeveloped or not developed at all, what we call hypoplastic or aplastic, that there's no lymphatic vessels, or the ones that are there are too few in number, or the ones that are there are normal in number, but abnormal in function. So that would be primary lymphedema, and that could occur in a lower extremity, an upper extremity, a combination of the two, other areas of the body. And unfortunately, through the LymphCast podcast over the years, we've met some wonderful people who were born with that condition and struggle from literally infancy and childhood through the rest of their adult life trying to manage that condition. The second general area would be called secondary lymphedema, and that means that you had a normal lymphatic system for some period of your life. It can be a very long period of your life, and then something happened to create either an injury to that system or dysfunction of the system. So common examples would be trauma, infection, surgical intervention where lymph nodes had to be removed for diagnostic or therapeutic purposes, but something that injured lymph nodes. And one of those things would be things that are surgical in nature, but not even necessarily directed at the lymph nodes, like, for example, orthopedic surgery and major general surgical procedures, vascular surgical procedures, where surgeons just have to, they have no choice but to cut through some lymphatic vessels, and that can cause problems.
It's like an acquired situation.
Correct.
Yes.
And one of the most fascinating ones, more common in developing countries, I think, than in North America, is a parasitic type infection that can actually obstruct. Have you seen that? Have you ever treated that? Or have you ever had someone on your podcast that suffered from that?
Fortunately, I have not seen it in my practice, here in North America, but I do have some colleagues like Dr. Emily Eicher, who's on the LymphCast podcast with us, who gets referrals from all over the world, especially since we have so much immigration to the United States and people come from all over the world. So she has seen some of those cases where various parasites can clog and block the lymphatic system, because the lymphatic system, again, is working to defend. It sees those parasitic invaders, tries to trap them and kill them and wall them off, but they clog that sump pump system. Imagine a bunch of leaves or something getting caught in your sump pump on that blacktop, and now it can no longer drain. So in those cases, the extremity can sometimes be gigantic. It can be, real, what we call elephantiasis. And it's a very sad and dramatic situation to see.
So you're a patient. You're going to the office. You have swollen leg or legs or an arm or whatever. Your family doctor does the history and physical. They rule out, I'm assuming, identifiable causes or other more serious causes. And then how do you make a diagnosis as a physician that it's lymphedema and not something else? Not like chronic venous disease or venous insufficiency or things that might look the same, or even heart failure. Mm-hmm. How do you distinguish those on history and physical examination plus or minus investigations?
Yeah, great question. First of all, our viewers have to find somebody who has real experience in this, because if you don't, trust me when I tell you, not that anybody's trying to harm anybody out there, but so few physicians have real expertise in this area that you really have to get to an expert.
And the key is early treatment too. I guess that's also important to say.
Early identification.
You don't want to delay it.
Sure, like anything else in medicine. The earlier that you can make a diagnosis and intervene, the better off you're going to do in the long run. But the first things that a good physician needs to do, and will generally do, is rule out other causes of swelling. So the classic causes of swelling would be things like congestive heart failure. Make sure that the pump is working okay in your chest, that you're not collecting fluid in the legs. Good liver function, good kidney function, low protein, things like that, malnutrition. So you rule out these other causes of swelling that come from other major organ systems, and that's pretty easy to do. A good doctor will know how to do that pretty rapidly. If your kidney functions normal, your liver functions normal, your heart functions normal, et cetera, your protein levels are good on your blood work, et cetera, that should be ruled out. Then you need to look at it carefully. Is it an upper extremity? Has there been surgery? As Paul said earlier today, a good history and physical. That's why the history of the patient is so important. What surgeries have you had in the past? Have you been traveling? Were you in an underdeveloped country for whatever reason? Et cetera, et cetera. Were you born in this country, or did you come here later and after childhood? So you have to be a little bit of a private eye, a little bit of a detective to figure that out. And then the physical examination becomes very, very important too. One of the telltale signs would be one limb as opposed to both limbs more commonly affected by a systemic problem like the heart, liver, lung, kidneys, and things like that. So you really need to go to a specialist who has real expertise and knows how to differentiate. One thing that you mentioned, Brad, that I want to touch on, one of the classic signs now that we know is lymphedema is something called phlebolymphodema, where you're getting, and you have a normal lymphatic system potentially, but because the veins are working so poorly and you have so much blood pooling in your legs that the fluid is accumulating so rapidly that sump pump system simply can't keep up with it. So you've overwhelmed the lymphatic system, and when you do that, it actually stops working properly.
Even though it was okay, you wore it out.
You wore out that system, overloaded it.
Okay, so we've talked about the different causes. We've talked about sort of the history, the physical examination of it all. And just before we go on to treatment, Dr. Chuback has mentioned the Lymphcast podcast. You should check it out. If you have lymphedema or if you're interested in learning more about it, it is a fantastic podcast. I have checked it out, and thank you for putting that out there. What are the treatment options now for lymphedema?
So the treatment options are really fascinating. Of course, it always goes back to tailoring a treatment to the problem. So you need to be in the hands of a good physician who is going to make the proper diagnosis, and then after making the diagnosis of lymphedema, then hopefully uncovering what the particular cause is for that particular patient. So if it's primary, it could be one set of treatments. If it's secondary, another set of treatments. A very classic thing that I deal with all the time, literally every day in my office, is patients who come with phlebolymphodema, meaning they have venous insufficiency, a form of varicose veins, if you will. And so the treatment there generally is to treat the underlying venous problem, get the veins working properly so that you don't get all of that pooling of fluid in the legs. And then hopefully if you catch it early enough, the lymphatic system will kick back into gear and do its job. There are general conservative measures like elevation, exercise, movement, using those big muscles to contract and constrict and squeeze not only the lymphatics but the veins and help that circulation. Compression garments, graduated compression therapy, like
wearing them right now.
That's great policy. Like there can be a knee-high compression garment, there can be a thigh-high compression garment. There are gauntlets for the arm and the upper extremity, what we call. Then there are mechanical pumps that can be pneumatic, and there are some newer devices that are not pneumatic, not using air bladders, but more sort of contemporary, modern technologies, which are fascinating, that people can actually walk around with. And then you get to, again, there are dietary modifications. We talked about flavonoids. Bioflavonoids are important.
Let's talk about that a little bit. Okay, so about dietary. So first thing, weight loss too. Obesity is a contributing factor, right?
It certainly can be.
Not a specific direct cause, but the increased pressure from the weight puts pressure on a low pressure system, which makes it harder for them to work properly. Now, what about diet? So let's talk about that. Are there any specific foods or supplements that people can take that reduce the inflammation and the oxidation that are related to so many negative processes in our body, and specifically lymphedema?
Yeah, definitely. Again, the weight part is very important, because it can compress the veins, even the big veins, like the vena cava in the abdomen. It's called what we call pseudo-obstruction. And if you're too heavy and you can't exercise, you can't move, that's a contributing factor. But after that, in supplementation, let's say with micronized purified flavonoid fraction, which is a mixture of 5 different flavonoids, including diosmin and the hesperidin fraction, these things have been shown to increase lymphatic contractility, lymphatic flow. They're antioxidant. They increase venous flow, also decrease capillary permeability. So this is something very safe that, again, is found in nature, comes from orange rind, and can be taken by mouth systemically, as opposed to just the external compression and things that we're also aware of. So it's a great thing.
And what we would say about the supplements, they don't necessarily work for everyone, just like most things in medicine, but definitely A, worth considering, particularly if you suffer from this, and B, generally very, very safe, which is also what we like about non-drug kind of related things like that. Very, very safe.
100%. You're always going to want to, like an exercise program, like any supplement you're going to add to your regime, your personal regimen, you want to pass it by your doctor or your healthcare provider to get their clearance, look at other medications and things that you're on. But generally, as you said, they're extremely safe.
What are your thoughts about lymphatic massage? So I have patients in my practice, and probably Paul does too, and you do as well, that come and say, listen, I go receive lymphatic massage maybe a couple times a week, where they very gently and superficially massage the fluid kind of back to your heart, really. What are your thoughts on that?
Well, it's a fascinating subject, and it definitely has value.
Yeah.
You know, I think that if we had some of the certified lymphedema therapists on the show, they would probably tell us that we should use terminology like MLD, manual lymphatic drainage, as opposed to massage. Number one, something that I've learned over the years. And then, you know, Dr. Weening, you're absolutely right. Historically, this idea of a very light touch drainage technique, manual drainage technique on the lymphatic system has gotten a lot of attention. But in speaking to experts like my colleague, Dr. Eicher, there's an indication for that. But now, apparently, again, this is not my area of expertise, but those people who are focused on that research and therapy and so forth are finding that there are moderate and even deeper levels of drainage that probably to us as surgeons makes more sense, but it seems that that's coming. That's kind of
the trend.
Yes, but all of these things are being investigated more and more seriously as more associations like the National Lymphoedema Network and so forth are really trying to apply good science to looking at these things.
Okay, so we've talked about lymphedema, we've talked about the different types, the risk factors, and we've talked about treatments now, things that are minimally invasive. Are there any surgical options for lymphedema that's just not getting better with all these less invasive treatments?
Yeah, this is one of the most fascinating areas. And as a surgeon, of course, it appeals to me because as surgeons, especially orthopedic surgeons, you know, no offense, guys, but they like to fix stuff, you know? It's
Absolutely.
like, got a broken bone, let's put these two.
I want it to be definitive and then be done.
Yeah, it's great. I mean, it's a great feeling to be able to actually fix something. So in the LymphCast podcast over the years, I've really had sort of an awakening and increased awareness with the different surgical options. One of the surgical options is something called a lymph node transfer, where you can take normal lymph nodes from one area of the body and transplant them into the same patient into another area of the body and hopefully have those nodes pick up the function there. And it's a really beautiful, delicate kind of microsurgical procedure, and it has variable results. In some patients, it's got great results. As you said, Brad, I mean, it's like any other treatment. There's going to be those who do great, those who don't do great, and those who are somewhere in the middle all the time. So, but it's something worth looking at, and you certainly need
a super subspecialized, right?
Specialist expert in that. You don't want, and the good thing about that procedure is it's not the kind of thing that, unfortunately, a lot of surgeons will kind of push the boundaries of what they feel comfortable with, but this is an area where they probably would not. Any good surgeon will tell you, you really have to find somebody who has experience with this because it's so little performed and little understood. The other thing that is being done is something called lymphovenous anastomosis, and that's where this is a beautiful, highly technical microsurgical technique where the surgeon goes in to various areas just under the skin into the fatty tissue and finds a tiny, tiny microscopic, less than 1 millimeter in size.
I was just going to say, so for people to understand, so you're trying to sew something that is very, very small.
Right. As a cardiovascular surgeon, I've sewn some really small things, like we do coronary artery anastomosis of a millimeter down to about a millimeter, where we use like an 8-0 proline kind of a thing. But these guys and gals are doing a connection, sewing together two vessels that could be 0.3 millimeters in size.
Obviously under a very powerful microscope.
Yes, under a powerful microscope, using what we would call 12-0 suture, which, to put it in perspective, is much, much finer than a human hair, much finer than a human hair, almost impossible to work with. So I give them credit for doing it. And they connect a tiny little lymphatic vessel to a tiny little vein, and sometimes it only requires one or two of those connections, believe it or not, to decongest and get the swelling out of a whole limb. It's incredible.
When you wonder if they can offset it a little bit, then the rest of the system works better. Kind of like you're saying, it was overwhelmed. Yeah. So if you just remove a little bit of the load, then the system can do some of it.
It's just that tipping point. It's fascinating. And if you listen to some of the real experts, there's a physician in Boston, I think in the Harvard system, who I was listening to one of his lectures recently. He said it very frankly. He said sometimes it works, sometimes it doesn't. When it does, it's wonderful. When it doesn't, they sort of take the attitude, listen, we tried. The last thing I would mention, which I found fascinating because it goes so far against a lot of our early surgical training, we had on the show a physician from Sweden named Dr. Håkan Brorsson, fascinating guy. And you guys would really be fascinated by him because he did orthopedic and plastic surgical training, right, which is really fascinating.
Glutton for punishment.
Yeah, he was. But the combination of his two skill sets led him ultimately to the management of lymphedema, and how he's treating lymphedema, both primary and secondary lymphedema, with dramatic results, and for more than 30 years, is with liposuction, believe it or not. And I would have thought that liposuction would be the last thing you'd want to do because you could injure more lymphatic vessels.
You just sucked up a bunch of the lymphatic
right
vessels.
But with the education that Dr. Brorsson gave me from his point of view, and this is his clinical experience, and he travels all over the world lecturing on this subject and publishing his results and research and data and so forth. His attitude is, you can't hurt what's broken. Those lymphatics are already burned out and shot, and they're not working. So to remove all of that, it's called kind of a debulking surgery, getting rid of all of that excess tissue can only help the patient. Exactly.
Yeah, makes sense. That's why weight loss.
And he has great long-term results following some of those patients at 20 and 30 years.
Wow, fascinating. Now, Brad, when I'm in the OR later today, I'm going to cry every time I cauterize one of these vessels that these people are painstakingly repairing.
Yeah,
and we just
number one fight.
Well, it's actually, it's one of the fascinating things for us as surgeons. Yeah. Why is it that we can do so much surgery
and not have this happen in every case?
A problem. Yeah. I mean, myself as a vascular surgeon, cardiovascular surgeon, as you guys know very well, a very common thing is to dissect out the groin. And you're going through tremendous amount of lymph nodes and lymphatic tissue there and so forth, either create, let's say, a fem-pop bypass or to cannulate for cardiovascular surgery or whatever. And the vast majority of those patients never get a swollen limb.
Thankfully, our bodies are very forgiving, generally speaking.
Okay. All right. So that is the lymphedema in a nutshell. We talked about what the lymph system is, who gets lymphedema, how to treat it conservatively, and even some more aggressive and cutting-edge treatment options. So, Dr. Chuback, thank you very much for sharing that. I learned something today.
Absolutely. I would say the take-home message is at the beginning. So, get seen, get assessed. Don't wait, because there's good studies to show that the longer you have it, the more fibrotic the tissue is, the higher the chances that it will not become treatable or reversible. Work on weight loss, stay on exercise, compression, maybe lymphatic massage. Consider something like flavonoids to reduce that inflammation, even elevation, like imagine lying on your back, legs straight up in the air. Temporarily that can help. Long term, the studies don't show that makes a big difference, but you want to do all those conservative things and then know that there are potential options for you, because this can be very debilitating. I only have a handful of patients, but they are cosmetically, they don't like how it looks. It limits their mobility and makes them have negative thoughts about themselves. So this is something that can be treated. So I think that's kind of one of the take-home messages here, that there is some hope for you, for sure.
Yeah, and I was going to say, advocate for yourself, please, because it's such a poorly understood area of medicine. Keep looking and searching. Fortunately, today with the internet, you can find specialists who really focus on this, and it makes a big difference.
Dr. Chuback is fascinating. We have his links and his contacts and all that in our description if you want to check out his podcast, his YouTube channel, or his company, or anything that he does, or even some books that you've written. Please check those out. And thank you so much for joining us talking about lymphedema today.
Pleasure. Thank you.
That's awesome. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.